views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Let me be your lighthouse so I can show you the way. Let me be your shining light, I'll keep you from drifting away. I'm the one that makes you try when...
Hello, good morning, good evening, good afternoon, whatever. Welcome to my show. This is Patty Hunter with Patty's Page. And we're in Studio A down at Access Fort Wayne TV station. Today, my special guest to my left is Stasia Roth. Hello, Stasia.
Hi, Patty.
Hi.
Thank you for having me.
I was just wondering, you're the executive director of A Mother's Hope.
Yes.
What is that?
A Mother's Hope is going to be a home for pregnant women who are homeless or without adequate resources and support.
So how long has this being put together?
Well, for me it started about 3 years ago, but we've had a board of directors for about a year and a half.
So do you have any co-founders or just you? Or
I do have a co-founder, Monica Kelsey.
Monica Kelsey, I know her.
I think you do.
She's my friend.
Yes.
So you're executive director, and you also have a website. We'll put that up. So it is what?
Our website is amothershopefw.org.
amothershopefw.org. Yes. Mm-hmm. So tell me more about this house. Do you have one yet?
Well, I actually have a little bit of news about that. We have acquired a home in Fort Wayne, with many thanks to the Mary Cross Tittman Foundation.
Tittman.
Yes. Yes. And but that's about all I can say is that we have acquired the home, but we'll have more news on that in the upcoming months. But we're very, very excited about it.
So when you have a opening, can I tape it or?
Yes, that'd be wonderful.
But it is somewhere in Fort Wayne. Is it
Yes.
Central or whatever?
Yes.
Can I ask?
I don't know if I'm allowed to say
Okay,
that.
I won't.
We're going to keep it a big secret.
Okay. How can we help A Mother's Hope? How can we volunteer to help out with any needs that the pregnant women need? How can we help out?
Well, we're going to have more things that people can help out with coming up in the next few months, but the best way if you'd like to get involved with The Mother's Hope is to go to the website and click on volunteer, and through that it'll give you some prompts and you can fill out your contact info and then what you'd like to do and what you're interested in helping with.
Because I filled it out the other day.
You did?
I did.
Wonderful.
See if I can help out.
That sounds great.
Yeah. How many women will be living in this house?
We will be able to house up to 8 women and their babies at one time.
So how long can they stay?
The women will be able to stay up to 2 years at the shelter. And the way that number came about was because some people will say, well, 2 years, that's a really long time with only serving 8 women at one time. How many women will you actually be able to help? And that number came to through a lot of research as to what other homes similar to A Mother's Hope are doing and what we've found works. Research has shown that women who go into this situation and they are pregnant, that they're at a very unique point in their life to make some changes. They might be more open to making changes because they're pregnant. However, the lasting change that we are hoping to help them make can't occur in a quick amount of time. However, from the first day that they come to A Mother's Hope, we hope to be moving them towards transitioning out of the program. Some women will have unique needs that are going to take longer to address.
You mean mental or physical or?
It depends.
Do you have counselors?
We're not going to have counselors on staff. at least not in the beginning. However, one of the beautiful things about Fort Wayne is that they do a wonderful job at supporting pregnant mothers. We have crisis pregnancy centers like Women's Care Center, a Hope Center. We have beautiful programs like Healthier Moms and Babies and Healthy Families that support pregnant women, but we don't have a shelter specifically designed just for pregnant women. And so we will be that missing puzzle piece in Fort Wayne that will help mothers who want to have all these things and need to be getting their services taken care of but don't have any place to live that's safe.
Well, you said homeless. Now, how can they get to your place? Do they have people, mission, what is it? Rescue mission or something? Help them to get to your place?
You mean to physically get
to
there, or to
physically
find
get
out
there.
about it, or
To find out and to get there. How can a homeless person know this?
Okay. Well, what we've found is a lot of the pregnant women that could be referred to us may call, let's say, the 211 number through United Way. So just since January through August of 2016, so just the first, a little bit over half of the year, of the homeless calls that 211 received, 57 women were pregnant.
Oh,
Isn't that staggering?
that's sad.
It's so sad.
Because of the work, not enough work, or they just can't meet ends, That's tough.
Very tough.
And how young are they? What's the youngest one that you'll be able to accept?
Well, we're looking into taking younger than 18. So we
Younger
are
than
looking
18.
into kind of the legalities of that and some of the having to sign over guardianship and those kinds of things. So we're still looking into that and the best way to accomplish that. However, from what I'm hearing from other homes similar to what A Mother's Hope is going to be in other areas of the country as well as Indiana, they're seeing more mothers in their 20s that are needing help. They're finding that the younger pregnant mothers are still able to often seek help from their parents or other family members or thing like that, but it's the mothers who are outside of that age group that tend to have the most need.
So you deal with, have you dealt with 16-year-olds, 14?
Through A Mother's Hope?
Yeah.
Not yet.
Because if they are pregnant and they need help, you would not turn them away.
I am hopeful that we will get the legal side of that worked out so that
Because if
we
they
would
are
not have
under
to turn them
16
away.
and they're pregnant, that's rape
Yeah, legally, yes.
legally, so they would be needing help in that area too,
Right.
and psychologically too.
Very much so.
So, yeah, how long, so you say up to 2 years, can you, do they move in while they're still pregnant?
The hope is that we would, yes, that they would move in while they're pregnant. That's the population that we're seeking to serve. Is so while they're pregnant, they would seek services. So let's say, for example, you have a mother who goes to Women's Care Center and she says, that she wants to parent, she wants to carry the baby to term, and she wants to then parent this baby, but she's not getting her prenatal care and she's not getting the things that she needs. And then maybe Women's Care Center staff finds out she doesn't have anywhere to live. So how are you supposed to be worried about getting prenatal care and
Medicine and everything.
medicine, all these different things that and getting your own needs met if you don't even have a safe place to live or where your next meal is going to come from? So we would be able to provide that for
Who
these moms.
sponsors you?
We don't have, you mean funding?
Funding you?
Funding.
Grants or?
We have had some grants so far. Like I said, Mary Cross Titman has been wonderful in
She's
helping us
beautiful,
with
yes.
the house. Yeah.
Yes.
They also have given us a matching grant as well. And so we're very excited about that. And then also we've worked with St. Joseph Community Health Foundation has provided us with a grant to do some professional strategic planning.
Yes.
So we've been working with a local place called True North, and they are amazing, helping us getting like a 5-year sustainability plan and some other plans in place so that when we open our doors to these moms, we can stay open and we don't have to say, I'm
You don't
sorry,
have to
we've
shut
run
the
out
door,
of...
in the future.
Wouldn't that be awful?
Yeah. You're a non-profit?
Yes, we are a 501c3.
So, what else? Do you have programs lined up for the woman in a mother's hope?
Well, something that we have been working on quite a bit is trying to see what areas our mothers would most benefit from having at a Mother's Hope, and then also utilizing the various services that are already available in Fort Wayne. So we are looking at our main areas of programming, of course, being shelter, because that's the main reason why we are there, and then also helping them with education, employment. We are a Christian organization, so that spiritual side, because we believe that you can help address all these things, but if you don't address the spiritual side, then the lasting changes won't be supported. So, and then we also want to help them mainly with health care. You know, there's a huge problem in Allen County with infant mortality. And the 46806 zip code in particular has one of the highest infant mortality rates in the whole state of Indiana.
Is that south side?
That's, yeah, it's right, fairly central, south central, Fort Wayne. So that's something that we want to address. So healthcare would also be one of the largest pieces of our programming. So making sure the moms are getting their prenatal care, making sure they understand nutrition, making sure they get their meals and things that they need, and then supporting them in making all those doctor's appointments and following through with their health care.
After 2 years, does the mother have to pay you back in anything, or is it all free for them?
One thing that we are kind of working on, one thing that I've been toying around with is there are some other shelters in the area that have some programs where they, when the mothers get to a point where they are working and they are able to bring in some income, of working on kind of like a mock rent program where they pay you rent, but then you actually save it for them and give it back to them so that they can use it to put towards their rent.
So you can be able to help them learn how to pay rent.
Basically like a practice run. So when that they're out, they kind of know how they're going to do those things, because we'll also help them with a lot of life skills like budgeting, cooking, finances. There's some beautiful finance programs even online that the moms will be able to utilize right from the house where they can learn, but also having people at the house and staff at the house that will support them and walk alongside them as they're learning these things so that they're not all by themselves.
So cribs and diapers and all that, do you supply that?
We will supply that. Cribs, though, we there's a Safe Sleep program in Indiana through Indiana State Department of Health. It's a beautiful program where the mothers, all of our mothers will participate in that, where they can learn about safe sleep practices either through Parkview Health has a program, and so does Healthier Moms and Babies. And then through that, when they go through this class, afterwards they all will earn a pack and play. So that pack and play, the kind of crib that folds up, that will be theirs while they're at a Mother's Hope, and then when they transition out of a Mother's Hope, they can take that with them to use for their baby if they still have a baby, and if they have a 2-year-old or close to a 2-year-old, then we'll work on getting them something for that as well.
The women that are pregnant, that do come in, what if something happens to the baby?
You know, I'm so glad that you asked that. That was something that we've just started talking about, and one of the things that we are doing right now is looking at 4 different maternity homes and how they deal with things, and that's one of my questions I really want to ask
stillborn.
them. And how they do that. We definitely would make sure that there's still, I mean, we're not going to say you're not pregnant anymore, you need to go. It's something that we'll need to definitely have a plan.
Because they'll be needing psychological help because
very
of the
much
baby.
So.
If they have a stillborn or the baby dies hours later
Mm-hmm.
or something like that.
Well, and I see it like this. If they were on their own or in the previous situation that they didn't have that support and they didn't have what they needed, I'm so glad that they'll be at a Mother's Hope where I know they'll be surrounded by people who care and support and will be there for them to walk through it with them.
Do you have nurses or midwives or?
We have actually on our board of directors, we have a certified nurse midwife, and we also have an RN and on the board, and then we're also looking into having a medical director, so there will be somebody who will help us with some of the policies and procedures as far as working with the pregnant moms and things that we'll all need to be on the same page on. A doctor.
OBGYN or just a doctor?
We haven't set anything in stone yet, but we're looking at maybe just somebody who has like a GP, somebody who could do everything.
That's
so
cool.
For the kids, because then we'll have babies and we'll have little toddlers, and so then we'll want them to be able to help them as well.
So you'll be near hospitals in case something happened to the mother?
we will definitely be near, not too far from hospital, and also on the bus line, so that our mothers can get to and from where they need to get. Also, it was very important to me and to our board that the home that we chose was nearby jobs, was nearby retail, was nearby restaurants. I mean, we're in Fort Wayne. We have a ton of retail and restaurants. We might as well be located by them so that people can get some employment. Now, that may not be long term, that may not pay a living wage, but it might be something to help get them there. It's a start, exactly.
How many people do you have on staff?
Well, right now you're looking at, this is the
Hello.
staff of a Mother's
Hello,
Hope.
staff.
We're all here.
You don't have a board of directors, or?
We do. We have
I'm
a board
sure
of
you do.
directors.
So you need more people to help you out when you do get the house.
Correct. And we are going to hire staff. One of the things we're doing with the strategic planners is looking at the best way to utilize the funds that we will have coming in to have staff to serve the moms. We'll have 24 hours a day, 7 days a week staffing.
7 days a week?
7 days a week.
24/7.
24/7.
So, will the mothers be, when they do get the babies born and all that, will you be helping them to encourage them to give their children up for adoption, or for them to keep the child?
Well, one thing that we feel is very important, several people on our board were adopted or have adopted. So that was something right from the beginning was part of the conversation.
Yeah.
And something that we want to do as the mothers are living at a Mother's Hope is talk to them about adoption and show them the beautiful option that adoption is. However, if they choose to parent and that's what they choose, then we will support them in that as well, because we understand that it is up to the mother of what is best, and we'll encourage her in whichever way that she chooses is best.
So if she gives the baby up, you have adoption agencies that you work with.
We've already been talking and looking at some of what other crisis pregnancy centers in our area, who they use and who they know does a really beautiful job. And they've given me some names, and we've looked into some of those just to know who celebrates adoption and can show the mothers and teach them about it in a positive way.
I would never put a child into a foster home. I wouldn't, because I hear so many negative things going from house to house to house. If you're adopted, you stay put. And do you screen? Do they screen the family that they are adopted into?
Very much so, yeah.
So it's legally, you gotta make sure that the kids are safe.
Right. And that was part of why, instead of just, looking up adoption agencies, that was part of why I went to the people that I knew had already done these things and had already worked with different places, and they knew who was going to do a great job. So
That's cool. That's cool. What are the requirements for the woman to enter your Mother's Hope?
there are various requirements. We will have an application process that they will need to complete, and they will have to meet with somebody at an intake meeting.
ID and everything. Well, if they're homeless, they wouldn't have any ID, would they?
Well, ID not necessarily, but different things like being 150% below the poverty line is important.
They have to prove that.
Then different things like being willing to participate in a program,
That's true.
being drug and alcohol free.
Right.
There will be a drug test, things like that.
Make sure the baby's okay too. They don't have drugs in the baby's placenta and all that. Yeah.
Yeah, and encouraging them to follow through with their prenatal care and different things like that will hopefully prevent some of those things. The three greatest causes of infant mortality are lack of insurance, lack of prenatal care, and young maternal age. So we will make sure they're getting their prenatal care. We will ensure and get them services so that they can get their insurance. So let's say they come to us and they have nothing. They have done no prenatal care. They have not.
They have no insurance.
They have no
period.
insurance. Nothing.
Yeah.
So then we'll make sure that they're signing up for presumptive eligibility, which gets them when you're pregnant, you get insurance right away. And Bright Point has a beautiful case manager that does an awesome job at that. So she's been very helpful at explaining it all to us because it's complicated.
Yes.
And so
I'm so glad that they're there.
Yes.
I'm glad that you're there too. whether you're allowed, if that woman's pregnant, she's in her 20s, she has other kids. Are they allowed in, or just her and the baby?
In the beginning, when a Mother's Hope opens, we are not going to be able to take other children.
There's not enough room?
The room is an issue, and from what I hear from other similar places, it would double our cost. And so as a startup, we're going to keep it as simple as we can in the beginning. And the other thing is, as a mother, it's very hard for me to say, I'm sorry, your other children can't come live with you. However, from what I've heard, a lot of the mothers may have already lost custody of their other children. Or maybe grandma will take the other children but doesn't want to house.
Someone else takes care of the children while she has her babe.
But if somebody were to come to us and they said, this is our situation, we would definitely try to help them find other shelter, even though they couldn't stay with us. So we wouldn't.
And if the mother is in an abusive situation, she comes to your place, is there security from anyone who might try to hurt her?
In the beginning, this is one thing that we've gone back and forth with and talked about. That may be a better referral for the YWCA, who would be better at handling that situation, because they are better equipped and would have the security and have those things that we will not have in the beginning, most likely.
So do you basically screen the woman?
In what way?
Well, make sure that she doesn't have any
background check?
Right.
Yes.
You do a background check. Okay, that's what I mean.
Check, yes.
I'm sorry, wrong word.
No, that's okay.
Background check. How long would that take to do a background check?
I don't know. I don't know how long that takes. I'm assuming it's fairly quick based on what I've heard from other people, but I haven't done any of those in a long time.
So how can the community help you? What are you looking for from the community? How can you and the community work together?
Well, the first thing I would ask is anybody that sees this, the thing we need most right now are prayers. We need prayers to help us all as we're navigating this and preparing to serve these moms and babies. Then in the upcoming months, we will have an announcement, like I said, more information about the house, but we're also going to have an announcement as far as when we start gearing up to open the house. So we will be looking for financial support.
So if you get the financial support and it gets everything established, I got to be there for the opening.
Well, I hope you are.
And I hope if this is like a pilot organization, pilot program here, if that works out, are you going to branch out to other parts of Fort Wayne and Allen County?
I don't know, but you're not the first person
to
ask.
I hope so, because I am awe of you. You're doing a really good job.
Thank you.
You do have a heart for the children.
I do.
So
when you ask me that, the first thing I think of is, okay, I've heard from so many different agencies. They see me and they say, are you open yet? Are you open yet? I had a mom last week. I had 2 moms last week. And I've heard from so many people that the day we are open, we will have so many referrals.
You'll be inundated
We'll be full with a waiting list the first day. And that is exciting in some ways, that we will be able to help these moms, but at the same time, it breaks my heart because I know there'll be mothers that we're turning away too. So it's a sad thing, but it shows just how much this is needed in our area.
So if you have to turn women away, of course you would have to if you only have 8 people. Are there other places they can go to that you can refer them to?
Yes.
Okay.
There is a beautiful network of shelters in Allen County, and that is a great thing. The issue is they all have waiting lists. And so, unfortunately, we will be no different. However, I hope that this does take some of that, a little bit.
A little bit off. What I was just worried about, there should be more homes like yours, because with the abortions and all that happen, it's no longer the abortionists here, but they can be referred to other places. But I'm just worried about if they couldn't get a home, would they get
often women who have abortions feel like there's no other choice. They feel like there's nothing else that they can do, that maybe they're in a situation where the family says, and this was something that we had in the beginning of A Mother's Hope, a mother that was pregnant with twins that we helped, and the people she was living with said, if you're going to live here, you have to abort these babies.
No, that's not right.
Yeah,
That's
and
so
it
not
was
right.
it was a tough situation, and so we tried to help her in the interim when she was trying to get into another shelter, and so it does happen, and women don't always choose abortion because it's what they want. They often
want the
choose it because
child.
they don't know what else to do.
No. So, through your website, which we're going to put up in about a second or two,
Okay.
we can be able to get how to get to contact you
Yes.
and where to send funds,
Mm-hmm.
the address and all that.
Mm-hmm. We also have a PayPal donate button where you can just click right on it and make your donation that way.
That'd be cool. So, Stasia Roth of A Mother's Hope, what would you like to say to my audience to encourage them not to give up and to love their children and seek help? What can you say to my audience who are out there?
I think what I would say to the audience is that A Mother's Hope is seeking to help a small number of women in the beginning. However, if we are able to help these women and show them that somebody cares and somebody wants to help them, then hopefully at this crucial time in their life when they are pregnant with this little baby, we can help them to make long-lasting changes that will not only affect them and their lives, but also affect the babies and then the babies' lives and then consequently their families. So we're looking to break that cycle, to break the cycle of poverty, and to help them and show them that there is a different way. There is a way that they can find happiness and success.
I would like to thank you for coming on to my show, dear.
Thank you for having
Stasia
me.
Roth, Executive Director of A Mother's Hope here in Fort Wayne. This is Patty Hunter of Patty's Page. Thank you for joining us today. I'll see you next week with another guest. God bless.
Godspeed, my love, until we meet again. You're always in my heart and every dream. Don't let this time apart give in to all our fears. God will keep us close from up above. So until we meet again, Godspeed, my